And I give the call to the honourable member for Reid.
Thanks, Mr Speaker. My question is to the Minister for Health and Aged Care. Will the Minister outline to the House how the Morrison government's health response to COVID-19's pandemic is helping Australians, particularly their mental health?
The Minister for Health.
Thank you very much, Mr Speaker, and I particularly want to thank the member for Reid for her work as a child psychologist before coming to this place, but also in terms of supporting the people of her community at this moment. Around the world, we know again another day with over 600,000 cases and agonisingly 9,800 lives lost. In Australia, we also know that the health investment of approximately $30 billion has helped save over 30,000 lives here. Sadly, we haven't saved every life, and we fight to do that every single day. But one of the things which is occurring, beyond the containment measures of borders, testing, tracing and distancing, is the vaccination. As the Prime Minister has said yesterday, a record day of almost 214,000 Australians, a week of over 1.2 million in the last 7 days. We are now at over 12.8 million vaccinations in Australia, and that includes 7 million just passed AstraZeneca doses, of which 5 million just passed are first doses of Australians vaccinated with AstraZeneca, and now 2/3 of Australians over the age of 50 have been vaccinated. But all of this provides a critical and important protection, but at the same time we need to focus on the mental health of Australians. And that's one thing which has been fundamental. We know the challenges, whether it's children or young adults or people of all ages, and the stresses that they face. On that front, the unity of the House, I believe, has been very strong. And what we've come together to do is to put in place structural changes, the creation of telehealth, the creation of a system which has delivered over 68 million consultations around Australia. Amongst those, 5 million have been specifically for mental health, but many more inevitably will have significantly dealt with mental health. That structural reform will have changed the delivery of Medicare and health services in Australia forever, but saved many lives during the course of this pandemic. In addition to that, we've also been able to support Lifeline, Beyond Blue, Kids Helpline and so many other groups, as well as doubling the number of services under the Medicare Better Access Scheme. This scheme was cut in 2011 from 18 to 10 services. We've now returned it from 10 to 20 services. And then fundamentally, as we go forward, the transformation of mental health treatment in Australia. 40 adult mental health services head to health around the country, over 150 headspace services, and for the first time 15 government-funded kids head to health services. All of these things are coming together to support mental health, to save lives and to protect lives.